Lyme disease, in my opinion, has kind of turned into this monster. It seems to be an untreatable, unsolvable problem, and this is causing panic. Basically, it's causing a lot of anxiety among the patient population. So I think what this is demonstrating is that with our standard approach to medicine, our standard approach to diagnostic and treatment, it's just simply not working, and this is really causing problems within the patient pool. So my personal opinion is really, if we're seeing that, maybe we need to take a look at it differently, and we need to start to utilize a different approach to looking at Lyme disease. And I think it starts with the diagnostics, because Lyme disease, we know Lyme is an actual bacteria, so the Borrelia bacteria, Borrelia burgdorferi, and there's other strains that can cause actual Lyme disease. So we're very fixed on looking at Lyme disease and finding these bacteria. But I think the mistake we're making there too is that we forget that when a tick bites you, it doesn't just have that. It has many, many other pathogens, microorganisms that it's passing on. So again, the Lyme community focuses on, a few of them, the Babesia, the Ehrlichia, and things like that. But really, we don't know the cocktail that tick has when it bites you. So from a tick bite, you might get, let's say, 100 different pathogens in your body. Do you really know which one of those are making you sick? So we focus then our search on looking for Borrelia and the 5 famous co-infections, but maybe that tick had none of those, but it had 95 of the others. So this is where we may be making a mistake with the diagnostics, that we're trying to look too specifically, and because of looking so specifically, we're losing the picture, or the overall picture. So I think that's an important change that we need to make in treating Lyme, and that's what we've done with our system here at Infusio as well. Then my theory too is, in order to get Lyme disease, you need the perfect storm. So you're going to need a tick bite, there's going to have to be something wrong with your immune system, and there has to be some damage to the cellular terrain. So with that I mean, if you're under a lot of stress, or you've had an injury, or just through terrible lifestyle, diet, things like that, that your whole system's just run down. So I think you need these 3 things to come together in order to contract Lyme disease from a tick. Then, going back to what I said before, I think we need to shift from calling it Lyme disease to tick-borne disease. So it can be a tick-borne disease from a tick bite. It can be some soup of microorganisms that you get, and they can take root if the perfect storm is there. So once you've got to that stage, then that changes the whole paradigm of treatment. And this is where the shift needs to be. So we're not looking at using specific antibiotics or antimicrobials to kill off the bugs, because so that you're going to need to know what's there. So maybe we need to change the terrain. So this would mean, optimizing immune function, which sounds simple, but it's actually quite a complicated science. And then changing the cellular terrain, making the cells healthy, because we know healthy cells have their own antimicrobial peptides that they can release, which are very unspecific, but they kill off microbes, and that's actually what we want to happen. So by optimizing the cellular terrain, you can basically lower the microbial load without having to know what it is, for example. And then when we're repairing the cells, we're looking at the detox pathways, making sure they're functioning properly. If there's genetic mutations there, maybe we have to support some of those mutations just to open up pathways within the cell. And once we've done all that, then I think we need to look at some basic repair to the cells, and that's where I like to use stem cell therapy. Because with that, we're basically using the body's own guidance system to find where the damage is, to find what needs to be regulated, and then we let it regulate. So again, it's not us going in there saying, oh, I need to change this, I need to change that. The body is regulating itself. And that's very unusual for medicine, because with medicine we want to know, I give you this drug and it does exactly this or exactly that in your body. And I just think with this disease, that's the wrong approach, because we simply do not know what exactly is wrong. So if we get lost in this looking for all these little details, and unfortunately that's what's happened to the Lyme patients, and I understand it as well. They go from doctor to doctor and they have this test and that test. Every test they do gives them more information, but it really doesn't give you a solution. So that's why, for me, I decided I need to take a step back from that, basically, and adjust my treatment protocols to look at the big picture. Of course, the big picture is not always going to cure everything. But I think with this approach, we basically optimize the patient. So if their immune system's working well, their microbial load is low, the cells are working well, we've given them stem cells for a lot of the repair. So if anything else is left, I think that's when targeted treatment can be used, and you'll probably find that targeted treatment works optimally in that case because the patient's been optimized beforehand. So I feel very strongly this is a message that Lyme patients need to hear. First of all, let's get rid of the Lyme, let's call it tick-borne disease, and let's stop looking at the details, but treat the person, change the terrain. Yeah. And I mean, we see plenty of examples of that in life. I like to use the example, if you have a garden that's full of frogs and mosquitoes, really frogs and mosquitoes are a sign that the terrain is boggy, that there's something wrong with the ground. So rather than treating the frogs or trying to eliminate the frogs and mosquitoes, maybe it's better just to drain the garden, dry it out, and then you'll find all those things will disappear by themselves without actually having to address them. So I think this is an approach that we need to look at for tick-borne disease, and that might take some of the anxiety out of the situation with the patients and basically give them more hope.